remind me, okay, ma'am? Monique is still there? Monica?
Yes, sir, I'm here, but I realized it wasn't being recorded.
Yeah, man, and I'm thanking you.
Okay, you're welcome.
You're welcome. So again, guys, nutrients. Nutrients are organic, meaning that it can be coming from living things, inorganic, meaning that it's coming from the environment, and other energy producing substances in the food that we eat. Those are all nutrients. And we spoke about nutrition, and we said that nutrition is a process of whereby the body utilizes nutrients or retrieves nutrients, right? And there are different parts to nutrition, but just to tell that digestion is a breaking down of food in order for you to get the nutrients, which is a part of nutrition, right? So it involves eating the appropriate type of food, breaking down the food for the nutrients, which is digestion, absorbing the food, the nutrients, using the nutrients for the purpose that they take in the body, and also elimination of the waste products is also a part of nutrition. Then we spoke about different types or different persons that we have to consider when we're talking about nutrition, of which adults with disability, persons who are disabled, right? Age, meaning very old, very young, diabetic persons, persons who are convalescents, pregnant and lactated mother, persons who need therapeutic diet, such as obese, hypertensive persons, persons with heart disease, persons with kidney disease. Now, there are different types of nutrients. You have water, protein, carbohydrate, fats, and then vitamins. And vitamins come under the term vitamins, right? But you also have minerals, vitamins and minerals. You have minor and major. And the major minerals would be like sodium, potassium, calcium, magnesium. And then you have trace minerals, would be like iodine and fluoride, all right? Now, it's important for you to have a balanced diet. Balanced diet contains the following: fruits and vegetables, right? Carbohydrates, meat, right? Food containing fats, and food and dairy and milk, okay? Now, be aware that as you realize this chart, okay, it's cut in different sections and different proportions, okay? Right here you have fruits and vegetables, here carbohydrate, and you see a part with meat. It's not that the whole of this have meat, as some people play it. All of this is meat, right? And then all of this is carbohydrate, and then right here so is what should I say now? Is the vegetable, or maybe no vegetable at all, right? It's essential that you know about balanced diet and how to promote proper nutrition, all right? Because that is one of your roles, okay, to ensure proper nutrition. Now there is the need for you to know that at different stages of a person's life, it will determine the type of nutritional requirements that you need. So that of an infant or a baby is different from that of a teenager, which is different from that of an adult, which is different from that of an elderly person. Also, it depends on if the person have anything else going on. So a person who is recovering from surgery has a different requirement than a person who is up and running, right? A person who is obese is a different nutritional requirement and compared to somebody that is starving, okay? What are the 4 common diets and what type of foods do these diets include? Anybody remember or anybody knows the different types of diets? Anyone? Types of diet. No. You have a low sodium diet, diabetic diet, right? You have renal diet. Anything else? And the renal diet is the same as.
Go ahead again. Yeah, right. You're talking fast.
Oh, right. So renal diet, which is the same as the low protein diet. Well, you can have other cases where you have to get low protein, but renal and low protein is similar. You have the hypertensive diet. Okay, diabetic diet. And the hypertensive diet is a low sodium diet. What other diet is there? Anybody?
So you have low renal.
No man, so low sodium.
Or low sodium.
Diabetic.
Diabetic, yeah.
Then renal. Most times the renal and the low protein diet is the same. And
hypertensive?
Is the same as the low sodium.
Oh.
Anybody knows of any other? The one after a surgery, what's that one called? Anybody? Well, it differs because around a surgery, you have a lot of stuff. You can have a fluid diet, right? Where you just straight clear fluids, right? Or it can be that it's soft diet or soft foods, right? That's when the person just finished surgery.
Sir, veganism is a diet too?
Well, yes, it can. And then the last one, which is most high, which is most times similar, is the high fiber diet, right? You have high fiber diet, low fiber diet. So you need to know those. Low fiber diet, high fiber diet. High fiber diet is for persons who have constipation. Low fiber diet is for persons who have chronic diarrhea, right? So you need to know those. All right, so state the special diets that are usually planned in the health. We spoke about those already, right? What is the progression of diet a patient is allowed following surgery? So they go from liquid, right, to soft food, right? Then they go to hard food, okay? And if you want to break down liquid, it can be clear liquid. So you start with clear liquid, you can start, and then after clear liquid, they may go to something like, you know, Supplegen and those things, which is non-clear liquid. It doesn't matter if it's clear or not, right? That's a liquid diet. So you can break it down. And then now they go to soft foods, which would be like mashed potato and stuff. And then now they go to hard foods afterwards, all right? All right. And then daily recommended servings for each food group. Which factors will influence variation in nutritional requirements? We spoke about the different factors already, like them have different illness, if them just come from surgery, if them obese versus the malnourished. Those are some things that will determine, right? Those are the factors. So if they ask you what are the factors that determine, okay. All right, this is some activity that you could do on your own here. This is just probably a summary of what we spoke about earlier. Now, provide food in accordance with cultural, religious, and dietary needs. We spoke a little about the dietary needs already, but what about culture and religions? Right? Remember, certain culture, you cannot give the person pork, you cannot give them certain type of food, right? Because that's according to their culture or their religion. Okay. So although food and water are essential for survival, people do not eat only to sustain their physical body. Food helps to meet social, cultural, and religious needs. So for culture, okay, it depends on the social or ethnic group that the person is a part of, okay? And culture strongly influences the eating habit of the person. So which foods are edible, how often foods are consumed, what food are eaten together, when food are eaten, what foods are served on special occasions, utensils in which food is prepared and served can all be determined by your culture, okay? Some people eat frogs, right? While we don't eat frogs. Okay, or maybe some of us don't eat frogs, right? I know some Jamaican.
Mountain chicken.
Huh? I don't
It's
hear.
called mountain chicken in Dominica.
Yeah, and they call it spring chicken, right? But I hear some Jamaicans say them eat it and it tastes like chicken. So, all right. And I don't know if you guys knew, but turtles can be eaten. Turtle, hear that it tastes like pork. Okay. It have different sections. So one section of the turtle tastes like pork, one section tastes like beef, next section tastes like ham. Some like it have different types of meat inside there. So yeah. Right. So all of these will be determined on your culture, right? So you say, for example, French people eat snails, and we would never ever eat a snail, right? I have never eaten a snail. But then Jamaicans eat kong. And kong is similar to snail, so what's the difference? Just saying, right?
Let me see.
How'd I hear you?
The conch are from the sea. The other one
But
was
that's still, but it's still built like a snail.
Well, probably them think a fish.
You need to probably take a picture, look on a picture of a real life kong. Hold on, it's fine. Kong. Anybody ever see live kong? Hello?
Yes,
Oh,
sir.
sir, I never see it before.
Kong.
Yes, I before, but I don't like.
It's how you even spell kong. I don't even know.
CONCH, but it gives herpes as well.
I don't hear you.
Gives herpes as well.
Oh yeah, that's so true. And you can get certain infections from it, actually. What do they call it? People eat kong. It's literally a giant snail. Hold on, let me show you guys. It's like a big snail. A giant snail. Look, kong.
Oh my, that's
So why we don't eat snail then if we eat corn? I don't understand. Maybe we need to try to eat.
Everyone else said that come from, my God.
Hey. Oh boy. Come let me traumatize some people. No, so
Sir,
probably.
what that commander? Protein?
Oh my God. Oh no. All right, so for many people, well, to answer your question, yes, seafoods, right? Still meat, so it would be protein, right? So however, Jamaicans eat ackee and goat meat, which are considered to be unacceptable in other cultures, right? So different religions to look out for: Rastafarianism, Buddhism, Muslim, Hindu, and Jews. We actually have Jews in the country, okay? Jews. Right. So, question. Does anybody know the cultural, or can you tell me some of the cultural things as it relates to Rastafarian and food? Rastafarian and
No pork, no salt for the Rastas.
What else?
No meat?
Majority of Rastafarians are vegetarian. Well, real,
Meat fish.
yeah. But the ones who die hard Rastafarian, they don't necessarily eat meat, whether or not it's fish or egg, right? So they are vegans. What is one of the things that happens to Rastafarians because of this diet?
Lack lot of nutrients.
Lack of nutrients. Okay,
Like
what is the
protein
major
and
nutrient?
Protein.
Protein, right? Protein. And what else?
Iron.
But remember, you can get protein from beans and legumes and those things. There's a particular vitamin that they tend to not get from plants. They only get it from meat. What's that vitamin? Let me hear the person who is reading ahead of us. Hello. Vitamin B12. Okay, so you can write that down. Majority of vegetarians, they lack vitamin B12. All right.
so when they don't eat food that contain that, they have to take the tablet, right?
Yes. Right. So guess what? Majority of the time when you see Rastafarians behave in a way and you say, Lord, what am I behave so? Am I going so muddy? And it can be because they are lacking vitamin B12. Because without vitamin B12, you can end up with a condition called megaloblastic anemia, which is a very common cause of madness. Can get what's called megaloblastic madness. Okay, so they behave like insane people, and you're wondering why. It can be because they're lacking vitamin B12. Okay, so it's not crazy, they're getting crazy. They're just deficient in vitamin B12. And once they get the vitamin B12, they go right back to normal. All right. everybody heard that. Do we have Buddhists in this country? Buddhists?
I feel so.
Oh, you know, which part of yes, Buddhists, ma'am?
I'm not sure, but you know, every little way. You may not see them plenty, but me feel see them there, just like how Muslim is here too.
They're
Yeah,
monks,
because them have
right?
a mosque.
They're monks. I believe we do have monks in Jamaica.
Oh, I did something to them, man. The church with them and the name, something the Father Olang, is that?
I am.
Because them head ball off and them have on one clothes like.
Remember, you have different types of what do you call it? No. So you have you have the males who are definitely with Christianity, and you also have monks who are Buddhist monks. All right. Majority of Buddhists are vegetarians. Okay. Majority of Buddhists are vegetarians. What about Muslims? Muslims. Anything?
Muslim don't eat pork.
All right. And so too the Jews. They don't like to eat pork because they have this claim that demons were cast out of people and they went into pork or something like that. I don't know if you know the story. And then the pork run on the jumping us into a river or something like that. So they don't like pork either. Okay. All right. And the Hindus, they are lacto-vegetarians. Okay, and everybody should know lacto-vegetarian by now. Name suggests it all, right? So even though they're vegetarians, they do consume milk, cheese. All right. So how do culture and religion affect food choices? Spoke about that. What other religion or denomination impose restrictions on patients' food intake? Anybody remembers those? It's kind of down here. Seventh-day Adventists, right? Denomination. They gave you the answer. So what are some of the possible consequences if healthcare providers fail to provide food that is in accordance with cultural, religious, and dietary needs? So for cultural and religious, it can lead to a lawsuit, right? They can sue against you for their human rights. Dietary needs in terms of renal, hypertensive, or something can lead to the outcome getting worse, okay? It can also lead to lack of trust, so the person cannot trust anymore. Can also lead to anxiety and withdrawal and depression in terms of the patient, right? So all of these you have to take in consideration. Prepare food and drink to enhance nutritional value. Now, good nutrition basically is the right food. And when we talk about the right kind of food, it's not just the right kind of food, but the right proportion of food. So you need to know that. So when they're talking about a balanced diet, your definition of a balanced diet should be the right amount as well the right kind of food. Okay? Or you can say the right kind of food in the correct proportion. All right. All right. Now, if it's a case that you're already having a certain type of illness, okay, the amount of a nutrient can impact you, right? If you get too much of something that will affect you based on your illness, it can affect you, yes. But if you have too little, it can also affect you. What is the most common nutrient that would be utilized in terms of prevention of infectious diseases? And we know, almost everybody know this answer. What is the most common nutrient that everybody start, once it's around the flu season, everybody start packing up on that vitamin? Hello?
Vitamin C, sir.
Thank you very much, ma'am. All right. Now, you know about vitamin C, but did you know that too much vitamin C can also affect you as well? So too little vitamin C, your immune system low. Too much vitamin C can also affect you. Yes, too much vitamin C can cause you to have stomach problems, all right? Too much vitamin C could also lead to you having issues with constipation, okay? So you have to be careful how you're consuming vitamin C. Can get burning, acidic stomach from too much vitamin C. Very common, something that happens. A lot of people rushing to the doctor with burning chest pain, wondering what is going on, if they're having a heart attack, when it's them consuming too much vitamin C. They consume the vitamin C tablet, and on top of that, they drink orange juice, and drink grape juice, cranberry juice. Yeah, and they don't eat anything else but fruits. All right. So the different cooking methods now. Methods of preparing food. You have dry heat cooking method, roasting, grilling, boiling, and saute, right? Or stir fry. Kind of like saute. Them do that a lot in the restaurants when they watch the TV and you see the man do that flip something and fling up everything and you know? Saute. It's a kind of Asian kind of thing, right? But there's a new one. Does anybody know the new type that's there? It's very popular right now, and you have a machine that you can use to get it, to achieve it. Anybody knows that one? There's a machine out there that allows you to do this new method.
Air fry.
Yes, air fry. Thank you. Air fry. Everybody know about air fry? Hello.
Sir, is it LT?
Yeah, man, of course. What? It is healthy. Okay, you not have to use no oil or nothing like that. It is healthy. It's very healthy. Air fry. I'm gonna do air fryer. Yeah, very healthy. Trust me. Actually, it's now the new way to go. Let me see if I can trying to get it up on my screen. If you want an air fryer, you can go by PriceSmart, by the way. It's about 20-some thousand. This is how they look. They use them a lot in America because through them have so much overweight people. I'm trying to cut back on the use of oil. And it tastes good. While I was there, my people, they kind of prepared almost everything that they prepared. They use the air fryer. Tastes good. And you just put on, you can probably, if you know, put on some stuff on it. And yeah, to go. Air fryer. So that's one that they don't mention. So if you want to sound smart and stuff for the person, the examiner said, listen, and do you know about air fryer? I'm like, what is that? Yeah, air fryer. No? And just tick off the paper and say, all right, check. All right, now you have moist heat cooking method. Moist heat. So as you know, that will sound like moist, so it's wet, right? So steaming, boiling, simmering, poaching, braising, all of those. Anybody know how to braise? How do we do braising?
Sir, same thing with them call fry and cook down.
Is it? All right, let me see if I can get braising up on the screen. Braising. Anybody? I've seen braising before. I'm wondering, is it the method where like it shows some water on it and then you just throw it on it? Is that a braising? Braising. I've seen braising before. Is that a braise? Oh Lord, a totally different situation. How to braise. Going to YouTube so I can show you guys how to braise. We're in a food and nutrition class today. Food and nutrition. So we're gonna be cooking tonight, everybody. Let's go to the kitchen. We're learning how to braise. Hey, right, guys.
Yes, sir, fry and cook down.
May I tell you, good job.
Sir, I did foods, you know, so I know.
Oh, wow, good job, good job, good job. So everybody heard about braising, right? All right, I don't know poaching. What's poaching? Anybody? The person
Like when you
from
poach an egg,
food. Huh?
when you poach an egg, like water boil up, they get the egg on a spoon, put it in it
Okay,
instead of fry it, and it come
cool.
out, but the middle of it wet.
Okay, cool. Everybody
It's
got
very
that?
healthy.
Yeah, I can imagine. Trust me. All right, so here are some cooking tips and ingredient substitutions idea that can help retain and in some case improve your nutrition. So decrease salt, and everybody know about decreasing salt already, right? Decrease the salt by replacing it with herbs and spices and vinegar and citrus juice, right? Garlic and onion, not garlic and onion, salt work well with meat, right? Choose methods of cooking that will retain flavor, color, nutrients. Steaming instead of boiling the vegetable, right? When you boil the vegetable, you actually decrease its properties, right? And you kill some of the nutrients, okay? So if you can steam the vegetable, that would be good rather than boiling it. Use olive or canola oil instead of the regular oil that we know about, right? And then use,
Sunflower and sesame oil.
right, those are also good. And use the microwave to cook vegetable, it is a healthier method because the short cooking time reduces the nutrient loss. Remember what we said? We don't want to lose the nutrient value, so we can microwave. But the microwave business, then I can only imagine the light bill still, but all right, fried is not an acceptable cooking method. However, in Jamaica, as we know, almost everything we fry, right? Our majority of stuff we fry. Even the most famous food that we eat is a fry. So that one is a bit rough. With the fried chicken, with the fried fish, escoffier, fried fish, this fried dumpling, fried festival, even the overnight food we fry, right? Why is it a danger if the fat in the meat or poultry stays in the cooking liquid? Remember, all of that fat and stuff, you should drain off, because if you leave it and you consume it, it's the literal fat you're going to consume, right? So you have to be very, very careful. Also, the soup, it has been known that you should peel off the skin from the chicken before you cook it in the soup. I wonder if a lot of persons didn't know that. Nope. So I know some people like the skin, but you should peel off the skin, peel off the fatty stuff off the chicken before you boil it or cook it down and stuff like that. Right? Because that contains a lot of fat. All right. So the soup, I know sometimes you look at the soup and it look fluffy, but that fat is not good for you. All right.
Only for oil and the top of swim.
Right. And then the high heat or high temperature can kill nutrients, vitamins, mineral, protein. All of that will be killed with cooking the food for too long. So when you're boiling it till it's soft, till it just a crush out, is not a good idea, right? Because you're not really getting any nutrient from that. Okay. Now, some of the things that you should look at is applying hygiene and safety standards. And one of the things that you have to get when you're preparing food for food institutions is the food handler's permit. Okay, and the food handler's permit is important to ensure that you are compliant with what is required for you to handle people's food. Now, some of the things that you have to consider is cross-contamination, and we know what cross-contamination is already, so we don't need to go through that. Washing the food, cooking the food. You wash the food thoroughly to remove dirt, insect, and chemicals, right? You're cooking the food now. Most food poisoning bacteria can be killed by adequate cooking. Okay, and sometimes one day if we get bacteria from KFC chicken, can boil that chicken raw sometimes, but it depends. It is. But you can literally know when food don't cook properly. But the problem that we have is that you can actually have food tasting extremely good and it is not cooked properly. Which food is the most common food for that? Which food? Most common food out there that you can actually be eating and it tastes very good and it's not cooked properly.
Chicken?
It's not chicken. Trust me, if chicken raw, you can know when chicken raw. Which food?
Sushi, sir.
Well, you're kind of close, but under that, seafood, right? Especially fish, right? You can actually look after fish and the fish don't cook good. And the person put a lot of spice and stuff on it and make it taste nice. and it's not cooked properly, and you end up with gastroenteritis, right? Because the fish raw, right? So seafood can be prepared raw, and you don't know that it is raw, right? Just typical example, sushi. Sushi is a raw thing. So you can imagine you eat it and you're not even realize. And then you can actually also know from Chinese food, certain Chinese food, Chinese restaurants, you end up with gastroenteritis and you say, oh, me get gastroenteritis, I may have diarrhea, and belly hurt me. And the food, it tastes good. And the person say, you sure the food cooked properly? And you say, yes, it tastes good, it tastes like it cooked. But especially when they have a whole heap of people waiting, them just throw in there, just heat it up, put on some whole heap of spice and the whole heap of wait name, sauce. Then just pour it on it, mix it up with the fried rice, give it to you. I eat it, especially shrimp. Shrimp can be done like that here. You can just basically warm up the shrimp and then just throw it in something, mix it up, and that's it. And you won't even know that it's raw. So you have to be very, very careful, right? Applying hygiene and safety standards, the provision of nutritional care, scope of care, give us practice and universal precaution. These are all the things that you have to take in consideration, okay? So ensure that there is proper nutrition, ensure that you know what you're doing and how you're supposed to handle food, and ensure that you're using universal precaution. Now, environmental hygiene and safety. Microorganisms contribute to diseases, and to reduce the spread of diseases, certain hygiene and safety precautions must be met when it's dealing with nutrition, either the administration of certain foods, or the storage or preparing or reheating of certain foods, right? You have to take all of that into consideration. So the storage, proper storage can prevent bacteria and cross-contamination. And the rules of storage are as such, okay? It should stay fresh, reduce the waste, and to prevent dangerous foodborne illnesses. And how you do this? You ensure that you have an idea of the date of the food, right? So that you can use the old stock before the new stock, so the old stock don't spoil. You keep potential hazardous foods out of a temperature danger zone, right? And immediately store certain foods in the refrigerator or the freezer upon receiving. And one of some of the foods that can be potential hazardous food would be like chicken, those raw meat, right? You can't leave them out too long and then you go cook them, because by that time bacteria would have contaminated the food, and when you give it to the person will be sick, right? Prevent cross-contamination during storage. So store raw food below cooked food. You hear that? Store raw foods below cooked food. Store raw meat on a lower shelf. Why? What happens if you store the raw food over the cooked food? Anybody want to tell me?
So sometimes there can be drainage.
Thank you very much. Very smart and very good answer. So if the fridge chip out or pour cut, then now you know the raw food will melt. The ice out of the raw food will melt, and it might drain down into the cooked food. And when it drains down into the cooked food now, you're not going to know when the light chip on back now and then everything just freeze up back now. The drainage out of the raw food gone into the cooked food. You understand? And you eat the cook, you go, oh, Jesus. Hey. Depression. But I know a lot of people never really picture it that way, but it has happened, right? And you wonder why you get sick. So transfer open packaged food to clean, sanitize food storage containers with tight lid and label and date the food, right? Maintain clean, dry storage areas and clean storage and transportation equipment. Do not store foods near chemicals such as bleach and peroxide, what do you call them now? Bleach and harpic and them stuff there. Don't store food on. Preparation now. Handling the food is of utmost importance to prevent food poisoning or hygiene risk. And handling the food would mean that you yourself have to be clean and right, paying close attention on cross-contamination, which includes washing and cooking the food. And you yourself need to wash your hands and ensure that your nails are clean, right? Raw foods, especially in the danger foods that are high in protein, will have bacteria present in their natural state. Okay? That's why some people want to say on the internet where eat what? They might eat like raw, them take up the raw chicken or the raw turkey and them just tear it off and eating it. And I can't imagine what's gonna happen to them a couple years from now. They're gonna end up with cancer of the stomach, okay? There are certain bacteria that can cause you to have cancer in your stomach, cancer in your intestine, okay? And trust me, it is not gonna be pretty. So eventually you're gonna just see them just disappear from TikTok and disappear from Instagram and you say, oh, to them, all them usually, da, da, da. You hear so them sick out, have cancer, probably dead in less than 2 years, right? You have to be careful what you do with your body. Your body is very, very fragile, okay? All right. So cooking destroys most harmful bacteria. Cooked food can be recontaminated by allowing the transfer of bacteria from raw to cooked food, all right? And this can occur with hands, utensils, equipment, or on surfaces, okay? The chicken and pork cuts must be thoroughly cooked so that the center is no longer pink. You hear that? Within a food and nutrition here now, you know. Food and nutrition. So the middle part of the meat mustn't be pink. So if you tear off the chicken and the chicken pink, you can safely go up to them and say, listen to me. The center of this meat is pink. Please cook it properly, right? You're not going to be all up in their face like that, but you're going to tell them that, you're going to educate them and tell them that the chicken wasn't cooked properly, right?
Sorry, I forgot to tell KFC that, you know.
Not true, not true.
Mm-hmm.
All right, so salmonella and other bacteria are naturally present in raw chicken and will only be destroyed through cooking. The larvae stage of certain parasites like tapeworm are only destroyed through cooking, right? Hear this now, some bacteria can actually survive cooking. These are usually associated with meat and cereals, right? The growth of these bacteria must be prevented by correct food storage. So guess what? You see, after you cook the food, you have to put the food up. Why? If you don't put the food up, the bacteria that survive the cooking is going to now proliferate. And how you prevent that from proliferating? You store the food in a refrigerator, okay? So that it prevents the proliferation of the bacteria, okay? After that, I know some people just take the food out of the fridge and then straight to the sofa and say, all right, I'm gonna just eat it cold. You mustn't do that. You should reheat it so that you can kill any potential bacteria, okay? And the microwave is a very good option to reheat. Okay, gone. All right. Do not refreeze leftover foods that has been reheated. Everybody see that? Who is guilty of that? Please reveal yourself.
We all are.
Maybe you're not understanding what it's saying. All right, so everybody know that, well, majority of you should have your Sunday, your rice and peas and chicken, because it's custom. You will put it in the fridge tonight. You will take it out tomorrow. You will heat it up, right? And you eat some for breakfast, probably. Not sure who else does that, but majority of us do. Or what you will do, you will freeze it, put it in your knapsack, in your lunch pan, carry it to work, put it in the fridge, take it out, and warm it up in the microwave, then eat it. Who does the last one?
I did.
Okay. The first one is not a good option, where you wake up in the morning, take it out the fridge, heat it, eat it, whatever left out of the reheat, you put it in your bag because it's warm, carry it to work, which maybe an hour of traffic, take it out, then now you freeze it, and then now lunchtime you reheat it and then eat it. You shouldn't do that. Already contaminated, okay? So best to do the latter one. All right, so serving. This is the last crucial step before food is received by the patient. When food is ready to be served, there are no steps to destroy bacteria, only control steps. You should be aware of how you can control contamination of ready-to-serve food. This can be done by washing hands before you're serving the food. So don't go to the bathroom, you poo and use the toilet, and then you just put your hand underneath the pipe, not even soak it up, and you go back to your patient and go give them the food. Nope. No. Thoroughly hand wash, all right? Pay attention to personal hygiene, not touching the plate and feeding utensils where the patient's food and mouth will come in contact. You know, it is a soup and you put your finger on the rim of the cup. No, you mustn't do that. Okay, you put your finger on the rim of the cup and then the person take it and then put that in the mouth. Using sanitized utensils to handle the food and wearing protective clothing are as required. Now we remember about protective clothing, right? What are the protective clothing? We still reach that part. All right, so some of the things that you should consider: washing your hand, cuts, abrasions, and burns. You should cover all of those with waterproof bandages. Illness, if you have a cough, cold, or anything like that, gastroenteritis, be honest. Don't do it and handle the people in food and you have diarrhea. Don't do it, okay? Tell somebody else. Don't be ashamed. Tell somebody else. Say, listen, I don't feel comfortable handling the people in food because I have something coming on. So please, if you can assist me, right? Don't do it, please. Because then you are going to contaminate the person. No matter how perfect you are in your technique, you're going to make a slip up and maybe touch your mouth, or you're going to sniffle and go touch your mask or something, right? Fingernails, you should cut your fingernails. Don't wear any nail extensions, right? While you're dealing with healthcare, you can't have nail extensions, unfortunately. I'm sorry. Jewelry, not to be worn while you're feeding patient. The piece of the pendant might drop down in the person. Soup, and the person will swallow your pendant, right? Grooming and uniform. On the personal protective equipment, okay, is important, especially when you deal with patients who are very sick and who are contagious, right? HIV victims, patients who have diarrhea and acute gastroenteritis patients, patients who have upper respiratory tract illnesses. Those patients you should consider using personal protective equipment, okay? If you're going to assist in passing an NG tube, all right. Smoking and eating. Follow proper hand washing procedures after smoking, eating, drinking, or chewing. This is important in preventing mouth-to-mouth contamination. So these are the hygiene guidelines as was depicted in the table above. And you should at all times keep those in mind, okay? It says here, it has been shown that one infected person is capable of causing food contamination. Remember not to provide nutritional care without washing your hands. Emphasis on personal hygiene for all healthcare workers and food service personnel is essential for food protection and sanitation practice. Of the guidelines mentioned above, hand washing cannot be overemphasized as it relates to prevention of contamination in the workplace or for the patient's or client's environment. Always use soap from a soap dispenser instead of a bar soap. The bar soap can actually cause contamination. Okay, I don't know if you guys knew that. You guys knew that? Hello.
Repeat the question, sir.
You guys knew that bar soap can cause cross-contamination?
Yes, sir.
Right, that's why we don't use bar soaps in the office, to be honest. So if you go to the doctor office and you're seeing bar soap, please tell them to replace it. Don't tell them that you're not acting as if you're a know-it-all, but it's not appropriate for the doctor's office. All right. A bar soap is actually a personal soap. So everybody in the household is supposed to have their own bath soap. I don't know if you did know that, but yeah. You can have a body wash where everybody share the body wash. Fine. But bar soap, definitely each person have their own bar soap, right? Just for you ladies out there, be aware that body wash causes yeast infection. So not to say, hey, yeah, go throw away a bar soap and go use body wash. And if you're going with a bar soap and you trouble with yeast infection, the preferably one is the Dove soap. Okay. Please tell me what this is. What is this? Hello. Hello.
A cap on your head?
What type of cap?
Not sure we are talking about. I don't know.
It's a hair restraint cap, right?
Your knit, sir.
Hair knit, right? And then she have on like something looking like a glasses. It's because it kind of blurry. What would that glasses thing be?
Goggles?
Right, and then what is this? You don't know this by now, mass or something wrong.
Mass,
Face mass, and then this is
the gum.
yes, right. Some persons call it apron, but yeah, go. Then this right here, gloves, and down here. Shoe cover,
Thing what
right?
them put over them shoes.
Shoes
What's
cover.
its name? Shoes cover. Okay.
Yes, a shoes cover.
Now it them use over them head too.
No.
It look
The
No,
one,
one
o-
different one.
the
The
one
one where
over
they
the head
put
is
the
very
shoes.
thin, right? It's very thin, and the one on the foot is thick, so it can resist the friction of the shoes onto the ground. All right. We know what are microorganisms already. We don't need to go through that. What is unhygienic about activity in figure 8? What is unhygienic about the activity in figure 8? What is unhygienic? Come on, guys. What about figure 8 is unhygienic? Which one can cause problems? If not careful.
The gloves.
Who said it?
I just did.
Yes, you wouldn't handle people food with gloves. All right. Can you imagine somebody that carry food and them I carry one apple and have on gloves. You look and say, where the gloves there come from? Right, the first thing you gotta ask, where the gloves there come from? Right.
Sir, so me to be a patient to have on gloves. So if you take it off, me not for be there in night.
Well, the
And me
bathing
not
part
feel-
is different, but the food definitely a no-no. Because the gloves can contain, the idea is that you wash your hands, okay? All right.
So you
Idea is
took
that-
off the glove?
You mean for food?
No, because she was saying the patient asked
No,
her.
I did not. I
No.
did not. I couldn't do that. And furthermore, she had scabies, so I could never.
Oh no, that's definitely no. Definitely no. All right, this question we answered it already. How can proper storage help to reduce the risk of contamination on food? Talk about that. Give 4 rules for safe storage of food and drink. Safe storage. Remember, raw food should be below cooked, right? Proper temperature, don't refreeze. Those little things you have to take in consideration, right? What hygiene and safety standards should you follow while washing food? When you're washing food, what should you do? Hello. You wash off all the chemical, wash off all the dirt thoroughly, right? So thoroughly wash the food to the point where you don't see any form of contaminant, right? Cooking food now. What do we say about cooking food? You don't want to overcook the food, right? So the time is important. Overcooking will lead to loss of certain essential vitamins and minerals. So you try not to overcook, right? As well as you do not want to undercook. So when you're cooking, you're not supposed to see the pink of the middle of the meat, okay? When you cut it. Reheating, remember we said that you don't refreeze and reheat, okay? And then thawing the food. Everybody know about thawing, right? Ensuring that there's no icy stuff inside the remaining in the food is completely deprived of ice. Okay, and serving the food to patients, proper hand washing, right? Ensuring that you're not contaminating the utensil, so you wouldn't hold the part of the utensil where the person putting in their mouth and handing it to the patient, right? You wouldn't touch the rim of the food, of the plate, right? Those kind of things. And you definitely would not consider using gloves to handle people's food. This activity is just talking about the different types of bacteria that can be involved in certain types of food, right? The bacteria that you should look out for, and I want you to make a note of these three, are Salmonella, right? E. coli, and Staphylococcus aureus. So make sure you know those three. Okay, everybody? And you can look at the different types of foods that you can get contaminated from in terms of these. All right. A common type of food that causes food poisoning when not properly prepared are salads and tomato. Okay. Salads and tomato. The bacteria love to harbor on these vegetables. Okay, so you have to be very careful how you deal with salads and tomato. That is why after a while, when you put it down, you just see it just start shrivel up, on because they love tomato and salads, right? So, So make sure you know those three bacteria, please. Salmonella, E. coli, Staphylococcus aureus. So if in case they ask you about the different types of bacteria, you can tell them. It says, you have learned that food can be contaminated during storage. If you were storing these food items on the shelf of the refrigerator, how would you store them from top to bottom to prevent contamination? So you have raw beef, raw pork, raw chicken, fresh vegetables, cooked casserole, frozen chicken, hamburger. Anybody want to tell me? What would you put at the top if you were to store them?
The hamburger would go at the top, sir.
Okay. You sure about that? What would the hamburger
The
be?
vegetables.
They didn't specify whether or not it's cooked in hold on for me. It depends on if the hamburger was cooked or not. Hello? Yes, so it would depend on whether or not that hamburger is cooked. But it usually hamburger are hamburger is usually, when they say just hamburger, it's most times the cooked hamburger, right? So I would put on the first shelf, okay, would put
So wouldn't you put the vegetables on the first shelf?
well,
Because you know the fridge normally cola going down to the bottom, and vegetables are last well in the cool. For example, if you put lettuce in the fridge down at the bottom, it way faster than up at the top.
Right, but remember as well, you want to decrease the contamination, okay? When we say fresh vegetables, are these washed vegetables? Understand? I'm not sure if you understand what I mean. Are these washed vegetables. So what we would need to do is to make sure we put the cooked stuff first, okay? So a hamburger and a cooked casserole will be on the top shelf, okay? The raw beef, raw pork, raw chicken, right? And the frozen fish would be going below, okay? Now, what would be the problem that I am having here is, does it include the freezer? What exactly is it that they're saying? Because if you have the freezer, you would want to probably put the frozen fish and so it's, let me read it again. It says, you have learned that foods can be contaminated during storage. If you were storing these food items on a shelf in the refrigerator, all right? So it says on a shelf, not the freezer, but on a shelf. How would you store them from top to bottom to prevent contamination? So I guess I just want to make sure so you know exactly what is what, right? So one, you put the cooked food first, which would be the cooked casserole, you put the hamburger, if it's cooked, right? You put it up there as well. Then now I would put the raw beef, raw pork, raw chicken on another shelf, right? And then the frozen fish at the bottom, to be honest, okay? Why I put frozen fish at the bottom is because that one contains the most water. So if it starts to drain out now or thaw, then it won't drain down on the raw pork and raw fish and stuff. Because it just said raw, it never said frozen, okay? So chances are it's just raw, right? Don't have the ice. Agree or disagree? And then, well, before you even put the raw beef, pork, and chicken, you would put the fresh vegetables, right? So it would be the cooked food first, then the fresh vegetables, then the raw meat, then the frozen fish. Anybody has any different answer? Hello? Agree, disagree? Nobody not talk, man. Hello?
Sir, me agree with you.
Agree? All right, cool. Yeah, man. I never say use a freezer, so we can't assume so we can put fish in the freezer. So. Oh, this I'm gonna have to scan this over. Involve individuals in the safe preparation and serving of food. So food preparation areas such as kitchens are filled with objects that can cut, burn, break, and crush parts of the body. And nutritional care requires a team of persons, and therefore the individual's safety, preparation, and serving of food means that the person have to be informed through proper training, good work habits, and careful supervision to prevent work-related injuries. Now, an illustration of safe food preparation. Use separate cutting boards and knives for meats and vegetable. Understand? Everybody saw that? So the cutting board that you have for the meat is different from the cutting board that you have for the vegetable, which is different from the cutting board that you have for the, what else? But most times you kind of cut fruits and vegetables on the same cutting board. You just wash them off really well. But yeah, you have a whole heap of cutting board. So. All right, now preparing and serving food in a safe manner reflects professionalism and consideration for both the patients and the fellow health worker. Some guidelines that you need to follow so as to prevent injury and also to maintain the safety would be to clean up spills after they occur, learn to operate equipment properly, always use the guards and the safety devices and wear protective clothing and fit properly to avoid wearing and avoid wearing jewelry, all right? As the jewelry can not only get caught in equipment, but it can also fall into the food. Use knife and other equipment for their intended uses only, and always assume that pots and pans are hot. Handle them with dry towel, get help or use a cart when lifting or moving heavy objects. Keep breakable items away from food storage or preparing area if possible, and warn people when you must walk behind them, especially when carrying very hot substances. Hold on. Remember that you are responsible for supplying food to your patient or client that is safe to eat, which means destroying microorganisms or using proper food handling procedures. In addition, you are also responsible for your own safety and for the safety of your coworkers. Maintaining sanitary and safe facility as well as high standards of hygiene are necessary and part of your responsibility as a healthcare worker, right? How can you involve individuals in the safe preparation and serving of food? They just went through all of that up there, right? Ensuring that the area is safe in terms of certain equipment, ensuring that the equipment are being used for the purpose that they ought to, right? Also serving the food, you know, about carrying the food when it's hot, making sure that persons are aware, right? And it's a lot of stuff they went through up the top, so can go through that. Any options you can proclaim. How can you prevent work-related injuries? We kind of spoke about those as well. What additional guidelines can you include for working safely while preparing and serving food? Any additional guidelines you guys want to make mention when dealing with food safety and preparing of food? Anything we didn't mention that you can actually say?
Chicken and fish are supposed to be at the same place.
Okay, all right.
I work at a restaurant before and they store them differently.
Okay, good. Yeah. What other guidelines you can think of apart from what is listed here? What about damaged equipment, right? So if the equipment is damaged, you discard of it, you don't use it, right? You know, some people have the cup break, right? The handle of the cup break, and you still serve the tea or the soup you still serve the tea in there, and then you hold the top of the cup, and you carry it and say to the patient, oh, don't hold on at the bottom, hold at the top, because the handle break. And then now the patient hold the top, not knowing that the patient is actually a left-hander and you're right-handed. So there's going to be a disproportion in the person getting the cup out of your hand. And what happens, I don't know if you realize, but when a person is left-handed and you're right-handed, your two fingers will collide. Your two middle finger and thumb will collide. And the thing will actually fall out of their hands. Anybody ever realize that or witnessed that before?
No, sir.
Yeah. Huh?
No, sir,
Sir.
I'm left-handed.
You would be surprised. Why is it that you don't get out? Take for instance, somebody's giving you a glass of water or giving you another thing, a rounded object, and you're left-handed and the person is right-handed, you tend not to grasp the thing as effective because there's a disproportion in terms of the hand. It commonly happens if you're not looking down at what is being given to you. But that can take place. So the use of defective, I would say, avoid using defective equipment. That's a good one to say. All right, so we have reached the end. We have reached the end of element 1 for nutrition. I need you to go back and read through. You can use the recording so you can move fast, right? You can speed up the recording, can put the recording to double or, 1.5 so that it moves fast so you can go through this within less than an hour. All right, and then you read back through it on your own. Any questions before we go? No?
Not today, sir.
All right. All right, no problem. So have a wonderful rest of the week, everybody. And remember, do not refreeze your rice and peas, okay?
Thank you, sir, for reminding me.
Yeah, but
Have a
no
good
problem.
night.
Yeah, but you too, bye.